Cardiovascular risk factors in childhood are associated with subclinical cardiovascular disease in adulthood, but links to clinical events in adult life are lacking. A new study examined 5 traditional cardiovascular risk factors among children and adolescents who were followed into middle-aged adulthood. In this prospective cohort study of 38,589 youths 3 to 19 years of age, data on body mass index, total cholesterol, triglycerides, systolic blood pressure, and smoking status were collected. These measurements were normalized into z-scores, and childhood and adult combined risk z-scores were also calculated. During a mean follow-up of 35 years, 0.8% of participants with follow-up information available had a fatal cardiovascular event, and 3.8% had a fatal or non-fatal event. Higher z-scores for the childhood risk factors were associated with a higher risk of fatal cardiovascular events, and of the composite outcome of fatal or non-fatal events. The risk was higher when all risk factors were combined. For instance, a per-unit increase in the combined risk z-score of all the childhood risk factors conferred a hazard ratio of 2.71 for cardiovascular death. Even some childhood measurements in the high normal range were linked to increased risk. Furthermore, the adult combined risk z-score was associated with adult cardiovascular events both alone and when paired with the childhood combined risk z-score. The authors conclude that childhood cardiovascular risk factors are associated with cardiovascular events in midlife. Full study results are available at nejm.org.